I wanted to give the folks back in Alabama a little update on our health care legislation and what's going on. Unfortunately, it's not good news. You know, it started out bad with this 1,300-page bill, which is going to drive up the cost of health care, and it's going to result in diminished quality of care. This was a 1,300-page bill that we started out with in the House. Then, when you say it can't get any worse, it did. Here's the 2,000-page bill that the House passed. Now, this included giving the same health care that you get to illegal immigrants. This included benefits for abortions. But besides those bad things, it also, again, would do things like tax your health care coverage. It might result in your private employer that you work for dropping your coverage. It would certainly result in, and has in every other country that's passed a bill like this, rationing of care, long lines, and not being able to, in many cases, choose your physician. So that obviously was a bad bill for that and 100 other reasons. So that's there. But then you say, well, it can't get any worse. Well, here it is. This is the Senate bill. And this is, hardly able to manage this and show you, but this was 2,000 pages. This is 2,500 pages. This is a Senate bill. And let me tell you something. This is not only a bad piece of legislation, it's an affront and an insult to everyone in Alabama, because it contained all these deals for other states that we didn't get in Alabama. And it's, to me, it's unconstitutional. I'll go over what some of them were. But I've asked Troy King to join a lawsuit asking around Christmas to sue, to try to stop this, because it makes you pay for things that you as an Alabamian are not going to get for other states. Here are some of the deals. The one you probably heard a lot about is this Louisiana Purchase. That's where Mary Landrieu took $100 million for Medicaid, extra Medicaid funds for Louisiana to get her vote. The Cornhusker kickback, that was where Ben Nelson got Nebraska exempted from higher Medicaid costs, but hidden in these 2,500 pages are a whole lot of other bad deals for Alabama. You had the Omaha Prime Cuts, as some people were referring to it, and that was a carve-out for new fees for health insurers in Nebraska. In other words, our health insurers in Alabama, those companies in Alabama are going to be charged additional fees, but not companies, not insurance companies in Nebraska. That was to get Ben's vote too. He really loaded up in this bill. Then you have one that I think ought to insult all of us, but particularly our iron workers. Our mine workers. Our mine workers in Alabama, along with those working for our railroads and many of our other companies, maybe perhaps your company, that has good health care benefits, you're going to be taxed under this bill for those health care benefits. If you have what one time was called a Cadillac coverage, but now it's really just Chevrolet coverage, you get taxed. But guess what? The mine workers in Libby, Montana won't have to pay those taxes. And that was to get a vote in Montana. And then you have the Yukon deal. That's $100 million hospital deal for the Connecticut hospitals. Our hospitals in Alabama don't get that deal. They don't get that $100 million. In fact, they'll be taxed and you'll be taxed to help pay for that $100 million for that vote in Connecticut. Then there's Gatorade. You may have heard where Senator Bill Nelson, he cut a deal for Florida seniors. Florida seniors can keep their Medicaid Advantage plan under this legislation. How about our seniors? No, they have to give up a lot of their Medicaid Advantage coverage. They'll face deep cuts. All you who presently have Medicaid Advantage, you're going to be cut, but not the seniors in Florida. That was to get his vote. That's why, as I said earlier, I've asked Troy King to file a lawsuit and to stop this. But we ought to do something else. We ought to not only try to stop the unconstitutional parts of this bill, we ought to throw this legislation in the garbage can. Well, that's the way to start. We need health care reform. We need to fix part of what in many cases is health care and many other government health care that doesn't work today. We need to fix that, and there are problems with it. There are problems with pre-existing conditions. There are problems with portability. And we ought to start over, and we ought to fix it. And let's do this. When we do that, let's do it out in the public. Let's not do it behind closed doors where they insert all these special deals in here. You know, President Obama promised the voters when he ran for office, and after he got elected, he said, and he said specifically in regard to health care benefits, we're going to have these negotiations in the public. We're not going to do it behind closed doors, and we need to broadcast it on C-SPAN. Did he do that? No, he didn't do that. That's a promise he broke. Let's make him honor that promise. Let's let the American people in on the deal making. And let's start by, as I say, throw this bill away with all its unconstitutional provisions, and let's fix the problems. Let's not go to a government-run, government-mandated health care, which is going to limit your choice. It's going to diminish the quality of your care, and it's going to cost you more, including taxes and fees. Thank you very much. Listen, we in Alabama are going to join with citizens in other states, and we're going to stop these special deals, and we're going to tell Washington we've had enough. Thank you.